Okay, Brad here, and I'm excited today to have with us Dr. Jeffrey Bibbee. Dr. Bibbee is Professor of History, as well as the Interim Associate Dean of the College of Arts and Sciences, all at UNA, and he also directs the UNA Center for British Studies. Thank you, Jeffrey, for joining us today.
Glad to be here.
We really appreciate you taking time out of your busy schedule to be here. And as I got to thinking about the current situation that we're facing with the COVID-19 pandemic, a lot of people have been connecting what we're experiencing with what happened beginning in 1918 with the H1N1 series of outbreaks that I guess lasted from 1918 to 1920. And I'm curious, I see that, during that time it was nicknamed the Spanish flu. And so maybe to start this discussion, do you know how it got that nickname or why it was called the Spanish flu?
Sure, yeah, and I think you're absolutely right to make connections between the current pandemic and the 1918 flu. The reason it's called the Spanish flu is that it originates during the First World War. And the various powers, both Allied and Central powers during the war, heavily censored their press. And particularly in the United States, Britain, France, and the Allies, they were very conscious of stories that would in any way diminish morale. So Spain was neutral. As cases of the flu began to emerge in Spain, it's reported in their press, and then it's picked up by the other media as a news story in a roundabout way. So it was one of those things they could report on something happening in Spain, and then they could make a connection to things that were occurring in their own country. So in Britain, it's called the Spanish lady. In the US, it's typically referred to as the Spanish flu. And so this is actually where that origin comes from. But it's also part of kind of a bigger concept, which is if we look at these other pandemic events, particularly in the 19th and 20th century, there's an outbreak of Russian flu in the 1890s. We have Hong Kong flu. So we often will subscribe these foreign names to pandemic events. So it's also kind of, there's another layer of xenophobia that comes with making it the Spanish flu, as it's something that's foreign and external to the United States or Britain or France as well.
Yeah, there seems to be a sort of natural tendency for us to want to blame someone else or another group of people for what we're experiencing. And that's interesting that the connection to sort of a freer press because of neutrality leads to, this nickname that gets stuck to, that particular outbreak.
Absolutely, and you are right. We like to, and this is something that's not unique just to Britain or the United States, is this idea of something being a foreign contagion. We aren't the cause of this, somebody else is, and it's been infiltrating our society. And we see this particularly with the Russian flu in the 1890s. It actually inspires not just conversations about flu, but it also, it influences literature, it influences music at the time, where this idea of Russia as an invading force in Britain is connected in with this contagion of the flu as well. So we can see this unfold in a lot of different pandemic events that happen in particularly the 19th and 20th centuries.
Yeah, that's really fascinating that there aren't just these sort of geopolitical concerns about how we look at these developments, but they actually, can impact, entire cultures.
Without a doubt. And so when we subscribe these particular names to pandemic events, it's going to continue to fester and it will continue to lead to other things. And we have seen that in the course of this pandemic with this idea of it being called the Chinese flu has also led to xenophobic attacks in different countries, bringing in Britain, as obviously with my research, they've been blaming the 5G network, which has been built by a Chinese company. And you're just going, okay, 5G is not what causes the flu. But again, we start conflating all these different issues. So that's a big part of what we have to see unfolding on a societal level with a pandemic event is what are the extensions, the knock-on effects that occur beyond just the medical issues that are happening to people at home and abroad.
Yeah, that's really really helped me, and it's given me something to think about, that we need to be careful, that we don't want to contribute to these xenophobic or conspiracy theories that do a lot of harm, than simply, clicking a link or sharing, some kind of fanciful article on Facebook.
Absolutely.
Jeffrey, can you tell me, why was it that the particular outbreak that began in 1918, why did it spread so quickly and thoroughly throughout the globe?
Well, in a lot of ways, it's the war itself. So, in 1918, we see the war wrapping up in Europe. And while there is some debate as to the origins of the virus that causes the 1918 outbreak, some say it actually originates in the United States. Others have said other places. It's the fact that you have a concentrated number of young people, which are going to be disproportionately affected by the flu. Disproportionately affected, all traveling in relatively rapid times. So we have that rapid demobilization, sending people back to their home countries, and in often confined and less than stellar hygienic environments. So you start putting a whole lot of soldiers on troop ships, and they pack these ships and send them across the Atlantic. You put troops on troop trains, which again are all kind of third-class cabins, pack as many people in as you possibly can. And so we see that it's really the trains initially that are the biggest culprit for spreading the virus. So you put all these sick soldiers in one confined area, and then you're going to spread them out throughout the country as they get off the train and start traveling home. It's just going to spread extremely rapidly. And in some ways, we might see some comparisons, bringing in today's virus, is that we live in such a global society. We can move around so easily between airplanes and everything else. So the idea of a virus spreading rapidly is very similar when you start looking at the patterns.
Yeah, that's what was coming to my mind when I was listening to you describe the movement of troops back home, is, how easily we travel from one part of the world to the other today. And certainly you can see the wisdom in shutting down international travel that was done. Maybe not early enough, but at least those restrictions were placed throughout the world.
Sure. And if we go back only roughly about 20 years in history, there's the Russian flu, like I said, in the 1890s. It takes about 5 years for that to become a truly global pandemic, in large part because there wasn't an ongoing conflict and there wasn't this rapid movement of people that we see at the end of the First World War. So the war itself is a big reason why, particularly the end of the war, is a big reason why it spread so rapidly, really within that first year, affecting almost every country around the world.
Wow, that's fascinating. So your particular expertise is in British studies, and so I'm curious, how did this outbreak particularly affect the United Kingdom, and how did the government and how did the people respond to what they were experiencing?
Well, that's actually, it is quite interesting. So a little bit of background on me. My research is in mainly late 19th and early 20th century Britain. So I look at kind of late Victorian and Edwardian Britain up through the First World War. But after I finished my doctoral research, I actually worked on a research project through the London School of Economics and the University of Edinburgh that was on pandemic planning. And part of what I was asked to do was to look at two things: look at historical events, so 1918 obviously being a big one, and also to look at religious issues as it related to pandemic events, because my research is in religious history. So in some ways, this was kind of fun to go back and revisit some research that I had been doing now almost 15 years ago. So that was quite fun. Britain is, it's an interesting case. So I've been trying to think about, because you'd asked me to consider some of the connections between what's happening in 1918 and happening today. And I think it's really important to understand that the last 100 years in British history have been amazingly transformative, particularly when it comes to things like healthcare. So Britain is, like every other country around the world, you have a lack of coordination, and you have a lack of information, and most critically, a lack of centralization that occurs during roughly the 3 waves that hit Britain. So there's a very mild outbreak in the spring of 1918. There's a major outbreak in autumn of 1918. And then there's what would arguably be a moderate to maybe slightly more than mild, I guess, outbreak in the winter of 1919. The first wave is those soldiers coming back. And the next wave really affects, interestingly, women, particularly women who are working in factories. Because like most, there's still relatively little knowledge amongst the general public about the spread of disease. We're understanding viruses much more, we're understanding bacterium much more by the early part of the 20th century, but the majority of the general public, this is not something that's part of their general knowledge. They're not getting this in a science class in high school the way that, you know, we did growing up. So the lack of coordination is that there is no central medical authority in Britain in 1918. One of the outcomes is going to be the establishment of the Ministry of Health, but everything's really being done on a local level. So you see a variety of responses when it comes to the government. So most communities are served by a local hospital, often a local charity hospital. So it's supported by either a philanthropic family or by religious institutions. So they have varying capacity to take in the individuals that are being affected. There are some coordinated efforts to try to promote the ventilation of spaces. For instance, they require that movie theaters have to be ventilated every 3 hours for 15 to 30 minutes in order to clear the air. But, you know, something we saw here is almost an immediate and universal shutdown of schools, obviously affecting both of us and affecting your kids. They did not have that in Britain. Some schools were closed, but not all were. There's a great example of Cheltenham Boys School, which is a very prestigious boys' school. Actually, they locked all the boys and teachers in the school and refused to let anybody enter or exit, which I guess shows that they must have had a pretty healthy food supply to be able to feed and house everybody during that time. There were efforts to fumigate spaces. So you did see like train carriages were being fumigated. Essentially what we would say is kind of a mixture of Clorox type bleach and water. But then again, you pack a train carriage filled with people all day, and the next, you know, it doesn't take long to contaminate the space. They encouraged people to brush their teeth. That was a way to ward off the flu. Eating porridge was encouraged. Now, I tried to find a good explanation as to why to eat porridge. Partly, there was a belief that, you know, if you have a full belly, you can fight off the flu better. I think some of this just had to do with the fact that it was a cheap and easy food to distribute. People were encouraged to drink milk, eat onions. Smoking was encouraged. It was believed that the cigarette smoke would actually help fight off the virus. There's some wonderful examples of people who were horrifically exploitative during the outbreaks, particularly during the second wave that was the most devastating. And you have these kind of charlatan, you know, pseudo quack doctor kind of folks. There was one called Pink Pills for Pale People. And I thought that was a particularly creative name. And of course, you know, none of this has any bearing on the disease, but it's a way to kind of exploit people's fears and anxieties. You know, we see a huge problem in Britain is going to be the poor themselves, inadequate housing conditions, substandard plumbing, particularly the living in close quarters. It was not uncommon in places like the East End of London or in the poorest parts of Manchester or Birmingham to have 7 to 10 people living in one room. Well, once one person gets sick, this is a highly contagious, easily transmitted virus. Everybody's sick.
Right.
The stories are particularly devastating with the 1918 H1N1 flu in that it affects young people in such a large number. And so you do have a collection of stories from Britain, like you have from every other country, of people, particularly in their 20s and 30s, that are being struck down almost overnight. You will see people talk about how someone will be, they'll arrive at work healthy, vibrant, active, and by lunchtime, they're unconscious, and by dinner time, they're dead because of just the immediate ravages of the disease. And so that also was one of the big problems in terms of containment for medical practitioners and government officials, was that it was happening so quickly. It wasn't like somebody got sick on Monday and then got progressively worse, or you could see symptoms coming on and isolate people. I mean, you had people that were 25 years old that were honestly gone within 24 hours, perfectly healthy to gone. There's stories of doctors, again, back to the war as a huge problem. About 50% of the doctors were already at the front and had been brought into military service. So they're still deployed in a lot of cases, particularly in that first wave. So doctors that were at home, most of those were older doctors, which in this case is going to be a little bit strange compared to the current COVID-19 outbreak, in that older people have one of the lowest mortality rates with this H1N1 flu. So these older doctors were at least had a better chance of surviving the flu than a doctor in their 20s or 30s, but they would often see 35, 40, 50 patients an hour. And so there's one story of a doctor in London who gets to a street, and he's doing house calls, gets to the first house, and there are 7 to 8 flu victims. He goes to the second house, and after he hits the third house, he's written a prescription at each of these houses, which is mainly for a cough syrup. It's not really anything that's directly fighting the virus. It's just for preventative, to try to suppress the cough. And what he does is he just passes the prescription on to the next house and says, when you write it down and go fill it and then give it to your neighbors and just send it down the street. Because at that point, he was already so overwhelmed with patients.
Wow.
Hospitals the same way. I mean, they can't keep patients, they can't keep beds. They don't have the resources. They don't have the nurses. They don't have the linens. Just simple things that they're not able to keep in stock long enough to be able to serve the entire population that's being affected.
That's certainly fascinating, and you've kind of hit on it several times throughout our discussion today already. But one of the things that intrigues me is what's different about the experiences in the United Kingdom in 1918 or around the world, and what we're experiencing, and what's similar. And are there any specific things that you think that you want to sort of close with that from those experiences 100 years ago that might inform us about how to deal with, the particular issues that we're facing with COVID-19 right now?
Yeah, I think in some ways there are a lot of similarities. And that is, one thing is that human behavior is really not radically different. We have different technology, or we have different modes of transportation and communication. But as people, we're often very similar, and our mindsets and our beliefs, our anxieties, our fears really don't change that much from generation to generation. Some things that are different between 1918 and 2020 in Britain is the development of the National Health Service in 1948. So what we are seeing in Britain now is a much more coordinated, centralized effort. Much like the United States, each day, governmental leaders and health officials are giving briefings. Their lockdowns and their decision-making has been less localized than ours.
Okay.
everything is being coordinated through the National Health Service and something called Public Health England, which is very similar to our health departments that we have around the US. I think the biggest things that I'm seeing is when there's a lack of coordination, a lack of communication, and a lack of information, people have a tendency to, as you said earlier, act on fear, share misinformation, and often that misinformation can be devastating to certain populations. Conspiracy theories can grow. So I think the biggest thing that I see is that we have to empower people with the right information, and it has to be grounded in science and in good public health practices. I think we also have to see that we all have a role to play. One of the things that happens in Britain in 1918 that I think to a certain degree we could argue we're seeing both in Britain and here in 2020 is this sense of it's not going to affect me. I'm healthy. I'm fine. I don't need to wear a mask. I don't need to socially distance. I don't need to be mindful of the people in the grocery store. I don't need to hoard toilet paper. Those kinds of things. That we need to take on a greater corporate mindset that we are all in this together, and that my actions impact the health and safety of other people. And this was one of the problems in Britain, was because it was so decentralized in 1918 that you had communities reacting in radically different ways. And so you would get what you see somewhat here between states or between counties and communities. Well, it's not in my town, so why do we have to do this compared to another town or another state? And we hear this a lot. You know, Alabama's not New York, it's not Washington, it's not California. But Britain was kind of dealing with the same thing in 1918. You know, well, that happened in Glasgow, or that's happening in Edinburgh, that's happening in London. It's not happening in my community. Unfortunately, because H1N1 is even more rapidly spread than COVID-19, just because it's happening in London on Monday doesn't mean it may not be in your community on Tuesday. And that's obviously, too, what we've seen here in the United States. I mean, the statistics, when you start looking at rural areas in particular, which have been arguably immune to COVID-19, is really due more to the fact that there's not adequate testing and not adequate medical care in those communities. But it's not that it's not present. So I think that's the biggest thing, is we need to, with proper information and with proper communication, we use that as a way to empower us to take care of each other.
Yeah, that makes a ton of sense, and I really appreciate that. So it sounds to me like we're all responsible to see ourselves as part of a national community where we act responsibly, but not just nationally, but globally during this time. And I think we can learn a lot of lessons from mistakes that were made in the past, or good things that were done in the past to help us today.
Absolutely. I mean, it's the past doesn't determine the future, but it gives us a pretty good indication of how things may play out. And so as historians, we do have this opportunity to say, here are successes and failures in past events, and we can learn from those. And obviously each event like this is different, and we have different actors, we have different events that will help shape and mold how this plays out. Our communication is so different, our transportation is different. But if this doesn't give you an understanding that what happens in China affects Florence, Alabama, and London, England, and New Delhi, then I'm not sure what will, because this is something that within just a few months we've seen something overtake the entire world, and it's going to be shaping us economically, culturally, socially. Our education system is being impacted by this. So it has a much greater impact than just the medical issues involved.
Yes, and that's really I think important for us to recognize that yes, there is the medical scientific part of this, but there is the social and cultural part of this that we all play a role in, and hopefully a positive role. Jeffrey, thanks so much for taking time out of your schedule to be with us today. This has been so enlightening and helpful. and encouraging that we can do some things in our own communities that help, that can encourage people. And we're so thankful that you spent some time with us today.
Happy to do so. I hope you and your family stay happy and healthy.
Same to you. Stay safe, and we'll talk to you later.
All right. Bye.